Hi, and welcome to the Total Health Channel. Thank you for being with us from time to time. Let's ask God's blessing on our time together. Heavenly Father, thank you for life in these days and for opportunities to share. We thank you for your interest in our health. Your word in 3 John 2 says, above all else, you wish we would be in health and prosper as our soul prospers. Please help us as we understand this principle of eating for Christ's sake. Amen. Well, there are millions of people turning to a keto diet to lose weight, and while weight has a special stigma of, it's not the sexy thing to do type of thing, to be overweight or obese, the reasons to go on some kind of weird diet to lose weight are really against the keto diet if we understand the disease factors related to the high protein, high fat perspective that induces a ketosis in the body. So we're going to look at that just briefly and count it up. But reason number one for not going on a keto diet is because you then look forward to going off of a diet. You go on a diet to go off a diet. Why not learn to eat well and do it for a lifetime? I've been doing that since I became a vegetarian in college, and I'm 77 now, will be 78 soon. Great health. And, I don't see anything coming for me. My cholesterol is low, my blood pressure is low, blood sugar is great. I have had a teacher, one of my teachers died last year, he was 104. And I have another teacher who called me recently, we talked at Loma Linda, John Schaffenberg, by the way, 96, he just got back from a mission where he spent months overseas. 96, well, traveling. I think that's great, and he had a picture he sent me with him with a chainsaw cutting a big tree. So yeah, we can do that, and I enjoy exercise. We live out in the country, and a hill behind us. I go up there semi-daily, maybe not every day, but walking up fast or jogging, and that's a healthy lifestyle. And diet is a key part of health. What we put into the body, into the mouth, is what the body becomes. So let's just look at the disease factors first of all. Number one, a keto diet is high in cholesterol, and it's bad for heart attacks. That's been known since the Framingham study in the 1960s. Number two is high blood pressure. And a high-fat diet makes the blood sticky, and the blood pressure tends to go up. This is what Pritikin was reporting in the mid-70s, that he got 85% of people off of their blood pressure medicine on a low-fat diet. Well, that's not the keto diet, okay, which gives ketosis. So my point is you're at risk for stroke, which has been the third leading cause of death in this country, cancer being number two. And so we'll look at cancer now. The cancer is the third reason why you really don't want a keto diet. High animal products favor cancer. Okay, the China study, more protein, more cancer. They turned it on and off with casein for one thing. It was recently reported. T. Colin Campbell, a professor of nutrition at Cornell, did this study over a 30-year period in collaboration with Oxford University and the government of China. And they found strong association with dairy, protein, high protein, and the risk for cancer. It turned the cancer genes on, basically. So not good for the three leading causes of death, and then comes diabetes as a bad situation too. Neil Barnard, MD, wrote the program for reversing diabetes, and it's fat that we take into our bodies that plugs up the insulin receptors in the cells so that the glucose can't get in because the receptor sites are blocked from fat. Okay, so not good. Diabetics, and Pritikin, by the way back 45 years ago, got people off of their medicines for type 2 diabetes, all of them, 23, all 23 patients, this was in a report in Medical World News, got off of their medication on a low-fat diet. And people who took insulin, I had a nurse, RN, type 1 diabetic, brittle diabetes, got a kidney transplant from her sister because she had kidney failure, and took 80 units a day, but reduced it to 18 units a day on a low-fat diet. That's not keto. Keto is high-fat, high-protein. Risk of diabetes, risk of cancer, risk of blood pressure, risk of heart disease, and osteoporosis, okay? Because the more protein you take in, the more calcium is leached from the bones to neutralize the acidosis that occurs in that metabolic situation. And finally, there's a risk, let me just say this, that all of these benefits of the keto diet to lose weight can be gotten from a mild form of ketosis if we just eat a different pattern of eating, okay? Specifically, if you look this up, I Googled this just to see, and fasting induces ketosis. And everybody should fast every day through the evening hours. If you eat a good breakfast and a good lunch, say breakfast is at 7 or 8 o'clock in the morning, lunch at 1 or 2 o'clock, then you have from 1 o'clock till 7 o'clock the next morning, you have 18 hours when you don't need to eat. And the point is that ketosis is induced in 12 to 16 hours. So you have a little time of ketosis where you might do good, and that fasting actually is good for your immunity. The opposite is also true during the holiday season coming up, when people gorge themselves, starting with Thanksgiving feast and Christmas goodies and candies and Valentine's Day, and they get the flu and so on. Not eating induces a slight starvation maybe of the white cells. They get very hungry. They'll eat any germ in sight when you're fasting. If you're overloaded, they get lazy. They won't fight the germs. You come down with flu. So not good. Why go to a ketosis induced by fats and proteins when you can just fast each night? If you have a good breakfast and a good lunch, you really don't need to eat a big supper. Supper at night makes your stomach work all night long, and in the morning you're partly sick. Why? Because you're not hungry. You have if you woke up vomiting, you'd say, oh, I'm sick. If you woke up nauseous, you think, well, maybe I'm sick. Well, most of the people, they're not even nauseous, but they're anorexic. No appetite. They're not hungry. Why? Because the stomach worked all night trying to digest stuff when you weren't burning it up. So do it differently. Try fasting with me. And by the way, it really helps the weight loss. If you will go out and walk in the evening instead of eating, you'll find that the pounds just melt away, especially if you use a complex carbohydrate diet and you don't put the butter on the bread or fry the potatoes and things like that. You can eat all the potatoes you want and the bread all you want. It won't put weight on you like when you fry them and grease them up. You don't need to grease the chute, as one of my professors said in medical school. So that's it for now. Think about it. The 5 diseases: heart disease, high blood pressure and stroke, cancer, diabetes, osteoporosis, and then if you eat a fasting type of diet, you'll have a better immunity overall. So God bless you. Thank you for visiting. Please subscribe to this. And if you want a really excellent DVD that will help you, motivate you, and help you know how to reverse most diseases, I have it on a website, offer it to the public. It's go to Richard Ruhling, Ruhling spelled R-U-H-L-I-N-G, and click on the Donate tab. It's $10, and I will mail it to you for that, no postage. You can really get it from Amazon for $10 plus $4 postage, so that's $14. I'm cheaper. I buy them in quantity, and I originally paid a friend $17 when he sent me the DVD. That was for the 2nd edition. It's 3rd edition now, 88 minutes long, something like that. And you will be blessed by it, enjoy it, and I know you know people either with heart disease, cancer, osteoporosis, overweight, all of these conditions, diabetes, that it deals with. So go to my website and click the Donate button for $10, and I'll mail you the DVD. God bless you. Thank you very much, and we'll see you again.